Learning outcomes of the program are based upon basic food safety knowledge and skills. The intended learning outcomes are: number 1, distinguish potential hazards and risks of cross-contamination to food before and during production, as well as when serving. Number 2, identify proper procedures for handling food during deliveries. Identify proper procedures for receiving food. Recognize food that is or is not in acceptable condition when entering the establishment. Number 3, identify proper methods and procedures that ensure food safety upon delivery.
Number 4, recognize proper food handling procedures to ensure food safety during food preparation, cooking, and serving. Number 5, identify proper hygiene, cleaning, and sanitizing methods for all areas of a food service environment. Number 6, understand proper personal hygiene to include hand washing and other areas of personal cleanliness and appearance. Number 7, recognize proper care of all surfaces, utensils, and equipment.
Course objective. The main goals or objectives of this training are to provide an understanding of food safety and to have a better understanding as to why it is important to follow proper food safety practices, to give you a foundation for preparing safe foods, to prepare you for the final assessment at the conclusion of this course, to help you obtain a score of 75% or more, which is needed in order to obtain your food handler certificate. So let's get started. Overview of modules. Module 1, Introduction to Food Safety. Module 2, Biological Hazards. Module 3, Chemical and Physical Hazards. Module 4, Cross-Contamination. Module 5, Personal Hygiene. Module 6, Receiving and Storage. Module 7, Preparing, Cooking, and Serving Food. Module 8, Cleaning and Sanitizing. Module 1, Introduction to Food Safety.
Food safety. Click on each box below to learn more.
Why is food safety so important? According to the Centers for Disease Control, CDC, about 1 out of 6 people get sick each year from contaminated foods and beverages.
Food service establishments work hard to prevent foodborne illnesses, and as a result, the CDC has stated there has been a decline in such illnesses thanks to the many efforts to keep food safe.
Let's take a closer look at foodborne illness.
What is a foodborne illness? A foodborne illness is a disease that is transmitted to people by food. A foodborne illness outbreak is when 2 or more people get the same illness after eating the same food.
There are many reasons why there are fewer deaths related to foodborne illness. Education on food safety, recognizing the hazards that can contribute to food safety, knowing who is at risk, government inspections, making the public more aware of unsafe foods.
A foodborne outbreak may adversely impact food establishments in a variety of ways. Reputation, negative media exposure, low staff morale, higher insurance rates, lawsuits, loss of customers, closure. The biggest loss is to the victims of the foodborne illness. Aside from missing work, they all face long-term issues and medical costs.
Certain groups of people are already at a higher risk of getting a foodborne illness. Pregnant women, elderly, infants and preschool-aged children, people who are already ill. These particular groups have a much weaker immune system than the average healthy person, which puts them at a much higher risk. Let's take a closer look at these groups.
Expectant mothers are at risk for passing a foodborne illness such as listeria, commonly found in deli meat, to an unborn child, which could cause a miscarriage. Some fish, like mackerel, can contain levels of mercury which can lead to complications and possible birth defects.
Let's take a closer look at these groups. The elderly are at a high risk because their immune systems become weaker with age. The elderly also have more outpatient care, hospital and doctor visits each year, which exposes them to disease. Let's take a closer look at these groups. Infants and children have immune systems that are not as developed as an adult, so these groups may be more susceptible to infections. Some children, especially, might be at more of a risk if they were born prematurely. In general, kids haven't been exposed to as much, so their immune systems aren't as tough. Let's take a closer look at these groups. The final group consists of people who have had previous medical issues. Examples include those who have had major surgeries, have had an organ transplant, or certain medications, or have a pre-existing or chronic illness. This group of people have persistently weak immune systems and are more susceptible to illness. Let's take a closer look at these groups.
No matter if someone works in a school cafeteria, restaurant, or any other type of food service establishment, the most important thing is to make sure the way the foods are prepared is safe for everyone. As a potential source of foodborne illness, establishments should do everything possible to follow food safety guidelines and prevent possible outbreaks.
Earlier, we learned the definition of a foodborne illness. Now, let's review the two types of foodborne illnesses: foodborne infection and foodborne intoxication. A foodborne infection is caused by eating foods that contain harmful microorganisms which can grow in the intestinal tract and cause illness. All viruses and parasites cause illness by way of infection.
Foodborne intoxication is the result of eating foods containing toxins that cause illness, such as home-canned goods, that may contain Clostridium botulinum. Toxins are the result of a chemical contamination or as a natural part of a plant or animal. They cannot be killed by conventional cooking temperatures when heating or cooling food. There are four main sources of contamination: biological, chemical, physical, and cross-contamination. Biological contamination involves pathogens or living organisms which can be hazardous if inhaled, swallowed, or absorbed into the body. Some examples of biological contaminants are bacteria, parasites, viruses, fungi, and molds.
Types of
Chemical contamination can occur when a contaminant is not properly used. Some examples of chemical contamination include toxic metals, pesticides, chemicals. Improper use includes storage and leaking onto food product. Physical contamination pertains to any foreign object such as hair, dirt, bandages, fingernails, eyelashes, metal shavings, broken glass, jewelry, plastic. The process by which bacteria or other microorganisms are unintentionally transferred from one substance or object to another, with harmful effect. This might look like using a cutting board for raw chicken, then using the same cutting board for lettuce for a salad, or cutting a loaf of whole wheat bread, then using the same cutting board to prepare gluten-free chicken nuggets. Physical contamination pertains to any foreign object such as hair, dirt, bandages, fingernails, eyelashes, metal shavings, broken glass, jewelry, plastic.
Time temperature abuse. Food that is not held or stored at the correct temperature. Food that is not cooked or reheated enough to kill pathogens. Food that is not cooled correctly. The following are critical to avoid: poor personal hygiene, which transfers pathogens onto food and food preparation surfaces; cross-contamination of food preparation surfaces; improper cleaning and sanitizing of food contact surfaces; time temperature abuse by allowing raw and ready-to-eat foods to set in the temperature danger zone too long, allowing for harmful pathogens to multiply.
Module 1 Summary. A foodborne illness is a disease that is transmitted to people by food. A foodborne illness outbreak is when two or more people get the same illness after eating the same food. A foodborne infection is caused by eating foods that contain harmful microorganisms. A foodborne intoxication is the result of eating foods containing toxins that cause illness. there are 4 potential contamination hazards for food: biological, physical, chemical, and cross-contamination. Food handlers following proper food safety practices have a huge impact on the health and safety of the public.
The following slides will give you an opportunity to apply your knowledge.
When one person gets sick with a foodborne illness, that is considered an outbreak. True or false? People have the greatest impact on the safety of food. True or false? Can you name the 4 potential hazards to food? There is no difference between a foodborne illness and a foodborne intoxication. True or false? Can you name the 4 groups of people who are at a higher risk of getting a foodborne illness?
If you answered any of the previous questions incorrectly, we strongly encourage you to review this module again. Congratulations, you've completed Module 1 of the training course.